February is American Heart Month. It's a time to raise awareness about preventing heart disease and promoting healthier lifestyles. Local researchers are looking at the ways technology and artificial intelligence play a role, not only in treatment and diagnosis, but also how we live our lives every day. A new survey from the Cleveland Clinic set out to get a gauge of how people like you are using technology to improve heart health and how you're feeling about AI in heart care.
Even though it's not prime time, so to speak, I think there's a lot of research being done in trying to figure out where exactly it's going to fit in.
I spoke with Cleveland Clinic cardiologist Dr. Ashish Suraju, who says AI is a broad term that refers to a computer's ability to analyze information in more advanced ways. Here are just a few takeaways from that study. 3 in 5 Americans believe AI will lead to bettering health care, while 72% believe the health advice they'd get from a chatbot is accurate. Nearly 90% will still get advice from a doctor before acting on those recommendations. And 50% of Americans use at least one type of technology to monitor health.
Being able to leverage these technologies to set good goals, to view daily progress, and to work with a healthcare professional to improve your health on a daily basis, I think it's a very encouraging trend.
Dr. Suraju says technology, like smartwatches, can integrate AI technology. But when talking about AI for heart health, there are a few different types of approaches for improving heart care.
We looked at whether AI chatbots could provide accurate information on cardiovascular disease prevention to patients as judged by cardiologists like us. And it turned out that the majority of recommendations it provided was accurate. There's other research going on looking at how AI can read images like ultrasounds of the heart.
Do you think that AI will take over the role of a doctor?
Personally, I would say that it's difficult for me to see how AI is going to take over the entire job of a doctor. Because ultimately, I think, and I can speak from my experience, patients really want to speak with somebody directly. That said, I do think there may be several aspects of what I do on a day-to-day basis that could be made easier if an AI model helped. So
Dr. Suraju says in the future, AI could allow him to spend more time speaking with his patients and getting to know them more, which he says is crucial. He also says it's never too early for people to start thinking about their heart health. Even if you consider yourself healthy, think about your risk factors and what you can do to improve.